Hi, my name is Sheila Mitchell and I'm a nurse practitioner student at Auburn University. I will be presenting a 5-minute presentation on precocious puberty. Precocious puberty is clearly defined as puberty too soon and recognized as the changing of a child's body into that of an adult. This is recognized by the development of secondary sexual characteristics such as breast enlargements and or pubic hair for girls by the age of 8 and penile and testicular enlargement and pubic hair in boys by the age of 9. Tanner stages of development define the standards of normal pubertal development in children and adolescents, which is also known as sexual maturity rating. There are 3 classifications to precocious puberty. You got central precocious puberty, peripheral precocity, and benign or non-progressive pubertal variant. Central precocious puberty, also known as gonadotropin dependent precocious puberty or true precocious puberty, is caused by early maturation of the hypothalamic pituitary gonadal axis. With central precocious puberty, the sexual characteristics are appropriate for the sex of the child, but they have accelerated linear growth for age, advanced bone age, and pubertal levels of luteinizing hormones and follicle stimulating hormones. Central precocious puberty can be idiopathic, which is the most common type, and caused by central nervous system lesions brought about by intracranial disturbance. The next is peripheral precocity, also known as gonadotropin independent precocious puberty, and this is caused by excess secretion of estrogen and androgens. Peripheral precocity may be appropriate or inappropriate for the sex of a child, causing virilization in girls and feminization in boys from suppressed levels of follicle stimulating hormone and luteinizing hormones. The last is benign or non-progressive pubertal variants, which includes isolated breast development in girls and isolated androgen-mediated sexual characteristics such as pubic or axillary hair, acne, and body odor in boys, from early activation of the hypothalamic pituitary adrenal axis. Most cases are idiopathic, presents under the age of 2, and may even be seen at birth. Risk factors for precocious puberty includes female gender, African American, obesity, exposure to sex hormones, radiation treatments, and or other medical conditions. Questions that you should ask when the parents come in is you want to obtain a family history. You want to find out what symptoms is the child having, what changes have occurred to the child's body so you can determine how fast the puberty is advancing. What medication is the child taking? You want to obtain a family medical history, particularly the family member's height and a history of endocrine disorders or tumors. The last thing you want to find out is what age did puberty begin for the sibling or the parents. Careful evaluation of children with secondary sexual development must be completed. You must do a physical breast examination for girls and do a physical scrotum and penis exam for boys. A comprehensive history, physical examination, a clinical follow-up may be sufficient if the clinical evaluation does not raise additional concerns. Labs are needed to measure hormone levels such as luteinizing hormone, follicle stimulating hormone, estradiol, and or testosterone concentration. You may also be required to get an MRI and or pelvic or testicular ultrasound. Treatment depends on the cause. Precocious puberty is treated with gonadotropin releasing hormone agonist, which is administered by an endocrinologist, which produces a prepubertal hormone states and stop the progression of secondary sexual development, accelerated growth, and undue bone age advancement. Early intervention is associated with a better outcome. May involve surgical procedures if a tumor is involved. If treated with pharmacology, puberty will resume when medication is stopped. Teaching parents that the child may be at a higher risk for sexual abuse. You need to monitor them from bullying, communicate openly with the child about changes the body is going through, and keep all medications out of reach of children. Thank you so much.